Health Alliance of India, and he will talk about healthcare challenges in developing countries and eHealth.
Good morning. Let me thank the host, NICT, and the Ministry of Internal Affairs and Communication and the organizers, ITU, for a very interesting and a very timely conference, a workshop. I think each session is like 10 dose booster coffee shots that you get, It is so stimulating. I have a topic which is challenges in the developing countries and eHealth. Now, what I'm going to dwell you on is 4 major challenges that the developing world is facing and how eHealth is addressing them. And I'm picking up examples from a big and a developing country, India. Towards the end of the presentation, I'll also dwell on the challenges that eHealth is facing and probably what we should do to address them. First, we should understand how eHealth was born out of. So eHealth was born out of the challenges of constrained financial resources, clinical resources, infrastructure, and increasing need of healthcare in rural remote settings, and the advancements in ICT. So if you see one side, the cost of IT is going down with its advancement. Other side, because of the complexity and the increasing cost of healthcare, the need for IT is going up. So there is no way you can have a healthcare system without having eHealth. For the last few years, I had an opportunity to review hundreds of proposals for funding in eHealth and mHealth, and I'm quite amazed when people use the word innovation. I say eHealth is no more innovation. It's a fundamental necessity of every healthcare system. There are 2 ways I look at eHealth services, one which are push-based and one which are pull-based. How we find them is, push-based is where the governments are pushing them and the customers necessarily are not willing to pay. It's a very generalized statement. Let me get into that. So mother and child health. Infant mortality and maternal mortality is one of the biggest challenges of the developing world. That's where you see government putting a major thrust and push towards mHealth and eHealth. Rural health, basically the mandate of the governments. Health screenings, not necessarily that the population is willing to pay. I think it's more important for the governments to address the issue of NCDs. Now, the pull, where people are willing to pay. The affluent class of population which is willing to pay for the secondary prevention or the management of NCDs. Second opinion, referrals and teleradiology. And we know that teleradiology as a part of eHealth or telemedicine has become an established commercial business. Geriatric care, one of the biggest issues for every major country developed or developing. And medical tourism, where you get treated in one part of the world and when you're back to your home country, you need to still stay connected with the care provider. So the only way to do that is through telemedicine or eHealth. Now, what are the priorities for the developing world? MDGs 4 and 5. We have seen there were MDGs, then there were MDGs plus, because most of the developing countries have failed or have lagged behind in the targets. So this remains one of the top priorities. As I am here, our Union Health Minister in India is holding a workshop in Chennai to address the issues of MCH. And I was a part of the Manila Declaration which was drafted last November by WHO Asia Pacific, which focuses on addressing the issue of maternal and child health, and we had accepted that use of technology is the key to doing that. Healthcare delivery in rural settings, NCDs. One of the important things is also the capacity building in the healthcare system, the healthcare workers training, which also remains one of the key focus areas for using eHealth in the developing world. So MDGs 4 and 5. Why? See, in India, if you see the maternal mortality rate is 212 per 100,000 live births. That is 1 death every 10 minutes. We need to get it down to almost like half of what it is. To get it to 109 per 100,000 live births by 2050. Unless you use technology, probably it's not going to happen. Infant mortality rate doing a little bit, but still behind. at 48 per 1,000 live births, and used to be brought down to 42 per 1,000 births by 2015. Now let us see, I have picked up one example for every challenge that the developing world faces and how we are addressing them. So in India, there are many projects which are happening using eHealth and technology addressing the issue of MDGs 4 and 5. So this is one project that I have picked up from the state that I come from. In this, as you can see, a remote rural healthcare worker uses a mobile phone and a dumb phone, not a smartphone, to enter data. That's an interactive SMS between the health worker and the backend. And this is the kind of actual reports that are lively screened. NRHM is the national flagship program of the Government of India called the National Rural Health Mission, under which the project goes down. These are the actual reports that one can see live across the nation. The most interesting part is the outcome. The cost of intervention is less than $100 per village. In a year and a half of being in operation, the maternal mortality was dropped from 91 per 100,000 to 51 per 100,000, which is an effective drop of 43.95%. So you can see on the issue of maternal and child health, eHealth has become one of the key interventions. And there is no other thing that has worked in the last 4 decades in the country. Delivery in rural areas. Why in rural areas? Because 70% of India's population is 830 million, I think many times the size of Europe, lives in rural areas. India has 640,000 villages. It's difficult to get doctors to work in rural areas. Even if you get them, the official absenteeism figure is 40%. At 40% of the primary health or sub-centers in rural India, you won't find doctors. So let's see how eHealth is addressing this challenge. So I picked up again a representative project which is operating in 8 states in 677 villages. They have done more than 200,000 consultations with a fee as low as 50 cents to $4. $4 being for the extreme specialist consultations. So pretty much affordable. They currently cover 40 million population. They plan to be reaching 70 million by this year end. See, one of the challenges that we have seen or we have discussed everywhere that there is lack of acceptability on eHealth. I mean, I beg to differ respectfully on that. This particular project, probably others as well, as high as 40% of the traffic of patient is repeat patients. I believe the rest 60% might be getting cured or being referred to specialist facilities. So the issue of acceptability is not an issue in rural India for eHealth services. These have these services typically like stethoscope, temperature, blood pressure, ECG, SpO2, besides others. These are the actual pictures of what you see as this health center. On one side you have this Sky Health Centers, which is a physical center in village. Then a person on a mobile carrying eHealth kit. And then you can see these 2 consultations happening. So it's very much happening on a scalable level. NCDs. We have seen in the past, I was an observer of the UN summit on high-level summit on the heads of state for NCDs. It has become one of the key issues that every country is trying to address, whether it's developing or developed. Why in India? 53% of all deaths in India happen due to NCDs. This is set to increase by 18% according to WHO in the next 10 years. This is more scary as a number. Raised blood pressure is prevalent in 32.5% of the population, which means 396 million Indians suffer from raised blood pressure, which is a very high number. When it comes to diabetes, it is 10% of the population, which is like 122 million. And these are the people who probably would have been screened, but imagine the number of people who are not screened. Already the Government of India has started a mass screening program, screening everyone over the age of 30 for diabetes and hypertension. As I speak, the latest data says we have crossed 14 million screenings. What India needs is a mass secondary prevention program for NCDs using eHealth or eHealth. I'll give you what's happening. These are actual pictures from India. And eHealth does have a solution for remote patient monitoring. All are US FDA CE approved devices, from checking from SpO2, blood pressure, blood sugar, spiro, total cholesterol, ECG, triglycerides, body composition, HbA1c, ultrasound, X-ray, doctor. Anything that you can probably comprehend that needs to be done for managing NCDs. whether it's a pill reminder service to a consultation for managing your screenings to point of care diagnostics, eHealth can deliver everything. And this is also happening in India now. Now is training of healthcare workers. So India started NRHM and we have 866,000 ASHAs. ASHAs stand for Accredited Social Health Activists. The lady who can read and write, probably 8% pass, resident of a village, a married lady. She works as an ASHA worker, educating people in the village, delivering OTC medicines, giving them advice, referring to a specialist center. The number of ASHAs are set to increase in future and probably double. There's a new course that has been started in India, which is a 3-year course for healthcare workers. Like imagine how would you train 1 million people, retrain them. Like ASHAs were trained for 7 days. I mean, if you need to retrain them, train them for again 18 days and so on. How could you actually get 1 million people brought to a facility to be trained? You cannot do that. Unless you use technology, unless you use eHealth, mHealth, whatever. So I am putting an example here again of how the training is getting addressed using mHealth. So it's again a project that I have picked up. It's a 360-degree approach to communication, launched 4 months ago, covers 29 million population, 8 districts, has already trained 40,000 workers. And they have used 1 million minutes of talk time by health workers for training. So clearly, there is a solution that we have, to train the healthcare workers, which will become a challenge of every country probably, if we want to address the issue of healthcare, which is probably important. Now the challenges for eHealth. This is a bigger challenge than, the challenges of the developing world. The lack of data and support of eHealth and successful and scalable eHealth projects. See, few years ago, we had tough time explaining our government and policy makers why we need to have eHealth. They would simply dismiss it as a gimmick. Of course, great work done by our champions for eHealth and mHealth. They have been convinced. 2 years back, it was put in the country's policies to use telemedicine for NCDs. And now this year, the policy document, they have officially said that all the sub-centers across the country and the primary health centers would be connected to district hospitals using telemedicine. The Ministry of Health official asked me, Rajendra, can you prepare a list of successful projects? Now that's the challenge. To convince policymakers, you need to have, they are not I'll say, my experience is they are not the kind of who are leaders to innovate and initiate things. They are followers. You got to show them success stories. Based on that, they will build their own plans. They have to play safe. I think what we need to make it, move from a pilot or probably pilot 1 to pilot 2 phase is to have, documented, successful and scalable eHealth projects. Another challenge is technical competence among the policymakers who are responsible for this is missing. Imagine someone asks you to give a cost of setting up a telemedicine center. It's an opportunity and as a challenge, because if you probably don't know it, they would never do it. Another big thing. Last year I was talking at a conference and a secretary of one of the most progressive states, I could even know him, is Gujarat, one of the most progressive states in the country. The health secretary came to me and said, okay, Rajendra, tell me, what's the ROI on telemedicine? Now in the corporate world, it's very fine to hear ROI because there has to be return to investors. I told him that in a rural area, if someone falls sick, he along with his entire family has to go to the nearest district hospital. The day they start moving, the source of earning stops and the spending starts. So there is economic loss in the society or in the rural population. So there is a loss to the rural economy when someone stops working. I said, in that case, how do you assess the return on investment when the family stops working and takes the patient to a district hospital? In fact, it should be looked as a value on investment rather than a purely return on investment basis, which becomes just one of the factors of value of investment. So I think the right way to look at the return on eHealth is to look at value on investment and not just purely financial ROI. The other big challenge that any one of us who have gone into the private-public partnership is there are 2 models one works on. It is build, own and operate it. So if you get a private sector to work and they build, own and operate, the chances of success are fairly high. The moment you get another model called build, own, operate and transfer back to the government, for sure, the moment that T gets in, the transfer, the equipment will be lying idle with the